a great look Monday. It was great looking downtown. We had no rain to speak of since early this morning. Temperature is going to be close to 64 today. You know what? We really want to put our best foot forward when it comes to spring. We have a wonderful season ahead of us. We have Dr. Todd Shatkin, who is back with us because it is Great Look Monday. We're going to be talking about what they can do these days for reconstructive dentistry. A lot of times, not having a great smile holds people back, and Dr. Todd is back, and we're happy to talk about this because what we don't talk about, and I know you have some pictures today, are people who can damage their teeth by grinding.
Right.
And I didn't realize it was as prevalent as it is.
Well, a lot of people do clench their teeth. If you're stressed out at work or you're stressed out at home or for whatever reason during the waking hours, you'll find yourself gritting your teeth or clenching them. But then other people grind their teeth in the evening while they're sleeping in bed, and it's just a habit. And sometimes the spouses can hear them grinding, and sometimes children do it too. They start at a young age, but usually that goes away as they get through teens. But some people really do some damage to their teeth.
Do they know they're doing it, or is it subconsciously in their sleep and they're not even aware?
Yeah, a lot of times they don't know it. Sometimes they wake up with sore muscles, soreness in the jaw, or maybe even a tension headache, and they may not know where that's coming from. But it can be pretty bad.
Wow, now here's a person who has ground their teeth down to nothing.
Yeah, their upper teeth, this gentleman's upper teeth have been ground down to virtually nothing, and the lower teeth are worn down as well. Here's another picture of it. And it's a tough thing to solve. We had to do reconstructive cosmetic crown and bridge work on all of the upper teeth, and then we did some fillings and bonded some of the lower teeth, and obviously gave this person back a smile that he didn't have for many, many years.
Wow.
And improved his appearance, but also improved his psyche because he didn't smile. He covered his mouth all the time, and we were able to build that back up to where it should be with nice crowns.
My goodness, what a difference. I can see why he's smiling in that last picture.
Yeah.
Wow. So even that can be corrected. So, I bet there's a lot of people who are embarrassed to come in because they think, my problem is so bad, you've never seen this before, and I can't even bear to open my mouth.
Well, in the past, to solve that problem, you really have to extract all the teeth and make dentures because it was very hard to fix those teeth. But now with all the modern procedures in cosmetic dentistry and bonded dentistry, where we can actually bond these restorations, even if you don't have a lot of tooth structure, we can adhere the crowns and bridge work to what's remaining, so you can have them stable for many, many years.
To think that you can go from the before to the after, and they're not dentures, they're not coming out,
right.
They feel like your own teeth, they look wonderful.
Yeah, and that's an extreme case, and most people that grind their teeth, they start to see some wearing of the edges, and instead of seeing the nice curves of the teeth, they just see a flat line. And if you look in the mirror and you see that, that's an indication that you're starting to grind your teeth. We can do a lot of things to prevent that from getting worse by making them night guards, mouth guards that they can wear to keep themselves from grinding and damaging their teeth.
So if you notice that your children are doing this, by all means bring them in and have you check their teeth before a bad situation gets worse.
Absolutely, and that can also cause problem with your temporomandibular joint. It can cause muscle migraines and muscle pain and things like that.
What do you do for someone who says they might have TMJ? Can you make them a mouth guard too?
Sure, yeah, we make different types of mouth guards for temporomandibular joint problems, and we sometimes use medications to help alleviate some of the symptoms, but also to stop their muscle spasms, to give them some muscle relaxation.
That's amazing. I just can't get over that before and after. I did not realize that grinding could actually lead to something that looks so bad.
It can, and this gentleman just covered his mouth all the time because he couldn't smile.
Oh, he must have just loved it.
And we do implants and all other types of reconstructive cosmetic dentistry procedures, including veneers and the implants to replace teeth, because he lost a lot of teeth. So in the back of the mouth, we put implants in to replace the missing ones.
Oh, we have a phone call for you. Hi, you're on with Dr. Shatkin.
Hi. Regarding the picture that was just done, is that actually that gentleman's gum line, or is that a denture?
This here is his gum line.
That's his real gum.
Right, because there's no denture.
There's no denture.
That's what I was wondering.
Yeah, these are porcelain teeth. Porcelain crowns.
And then once you have an implant and they make a crown or whatever, does that feel like your real teeth?
The implants actually do feel like natural teeth. It's amazing how, in fact, in some ways they're better than natural teeth because you don't have sensitivity from hot and cold, and you can't get cavities in them. And the people who have the mini implants, and we can do this in one visit. We can put implants in permanent teeth to replace missing teeth. People can go out and eat anything they want, and they feel like they've had them forever.
Yeah. And I can speak from experience. I've got crowns in the back because the teeth were so decayed. That's what happens, when you get older and older and you keep getting decay. And so they've been crowned, and they feel exactly like my other teeth. Yeah, the mold is exactly the tooth that they took out. So, and like you say, there's a lot less problems with them down the road, and you don't see any silver anymore.
And we can make them look, just like your own teeth, or if you want them to look better, we can make them look better than your own teeth.
It's whatever you want.
That's what's exciting about it.
We will take more calls for Dr. Shatkin, and while we're waiting, I have to remind you that Dr. Sam Jr. was in last week, and they're having an incredible seminar that's about wellness, and it's called Show Up for Life Presents Look Great, Feel Great. And it's for women only, and it's coming up April 29th. And they have Dr. Catherine Ann Sweeney, who is the keynote speaker. We have Dr. Sam Jr. will be there, Chef Jim Repholz. Dr. Rifkin from the Sleep Center. Robbie Raw will be there for health and fitness. Sharon Lawrence will be there, nutrition expert. And Dr. David Kurz, gynecologist and expert in women's wellness. This is coming up. It's for all women. It's a one-day seminar. Go, bring your daughters, bring your mom. Sign up for it. It's Sunday, April 29th. And it's a very proactive way to keep an eye on your own health from top to bottom. So we want to invite everybody to make sure they sign up for this, because they will cover sleep, nutrition, anti-aging, total fitness, plastic surgery, hormones, menopause, total wellness. So we can't get enough of seminars like this, and it's great that they're putting that on. You'll go to the next one, right?
Absolutely.
We have another phone call for you. Hi, you're on with Dr. Todd.
Hi, good morning.
Hi.
Hi, good morning, doctor. My question is actually regarding my mother, who wears full dentures, and she has that plate on the top. She has a very small mouth, and she seems to be actually sort of choking on these dentures. They look good, but they're just not comfortable for her. What can she have done?
She's got a very common problem, which is a gag reflex from the roof of the mouth being covered by that plastic. And what we do with those, I wish I would have brought a model today, but maybe next time I can, where we can actually remove the entire palate of the denture, the plastic portion, put some mini implants in, and we can snap that denture into place, and it'll be secure, it'll look great, and she won't have that problem with the gag reflex. And in addition, she'll be able to start tasting the foods that she enjoys, because you have a lot of taste buds on the roof of your mouth, and when that's covered, you don't enjoy the foods as much. So the hot, the cold, and the different taste buds of different foods you'll be able to enjoy better.
That's great. Now, when someone comes into you and they have issues with their denture, should they bring it with them?
Absolutely. You have to bring your dentures with you, and if you have old dentures that maybe you liked better than a new set, bring those with you, because we can use those to make the new ones in a comfortable, manner.
All right, so there you go, everybody. We want you to have a beautiful smile, not for just this season, but for the rest of your life. And it's easier than you think, and certainly the process, it will astound you how many different things they can do to achieve the look that you're going for. The Aesthetic Associates Center, wonderful people. They're there to help you. They are located at 2500 Kensington Avenue in Amherst. Give them a call, find out what your issues are, and talk to the folks who can help you with them. 839-1700, 839-1700. Give them a call this morning.